Welcome, everyone. It's a great pleasure to have you again this week. We have a good friend of mine, Marta. She's a very passionate woman about mobile health, and I would like for her to introduce herself so I don't miss any of the details about her background.
Romero, thank you so much. It's a pleasure to be here. I'm delighted to have the opportunity to talk a little bit more about, as you said, my great passion in mobile health. I'm actually a CEO of a startup company in Silicon Valley that does not work in mobile health. But what I do at Stanford University is I help direct a class called BioDesign for Mobile Health as a lecturer for the School of Medicine at Stanford.
Excellent. And that class is part of a very important center that we have here called the BioDesign Center, which is a joint venture from the Department of Surgery led by Dr. Tom Cromwell and also by the BioDesign Center led by Paul Yock. And now they just started a class in BioDesign for mobile health. So I'm going to ask Marta to tell us what are the important lessons that you have learned from this class so far?
Thank you very much. A little bit about the class actually might help understand what are the main things that we learned from running it. So the class started in 2010, and it's a class focused on the values of entrepreneurship, innovation in mobile health, and it is a class that unifies many experts from several segments that have a role into creating successful entrepreneurial endeavors in mobile health. So we see many guests in panels throughout the course of the class, discussing with students in a very interactive scenario about clinical applications, business models, fundraising, and policy issues. And I would say three things I learned from the class, from running it last year. The first thing is that it all really starts with clinical applications. What are the medical needs? And certainly you can relate. It's a very clear message for the BioDesign Center. Unfortunately, it is true for all sectors of the healthcare industry, but particularly so I've noticed in mobile health, where technology is abound and sometimes you see many in search of a problem instead of people trying to find solutions for actual needs. It's a clear message that we always try to deliver during the class, and we do so by starting the conversation with a first seminar that is solely focused on clinical applications.
Exactly.
Of course, we are a class in mobile health, and so we seek solutions in that arena, but it's very important to make sure you understand what you're trying to solve.
And I think that number one lesson resonates very well with one of the previous classes we had here about patient at the center of care, because we have to listen to the patient's needs and we have to see what are the, also the needs that we have encounter when taking care of those patients, and then look for solutions. It's not the other way around. And that is very similar what some of the people who do work with medical devices, oftentimes they have a technology that they can apply and they just look for problems. And that is always a recipe for failure. Okay. So what's number two?
Number two, staying on the subject of technologies. I would encourage entrepreneurs to seek for technologies that are very simple. I've seen some brilliant solutions that do not require entrepreneurs in mobile health to reinvent the wheel, but actually some of the best, most affordable and most effective solutions are those that are borrowed from other fields and with great ingenuity applied to solve solutions in the medical field.
Exactly. Well, number two is finding something that is simple to apply. And usually simple solutions are best for complex problems. There's many times that we just get so isolated from working with other people who actually have successfully implemented those simple solutions in other arenas, that if we make our group very diverse, then we will make things better because we can learn from their mistakes, we can learn from their successes, and then we can apply them into this emerging field, evolving field of mobile health.
Very well said.
Very good. And the next solution?
I would say lesson number three, which I learned, is that the time is now. I've seen many entrepreneurs in many fields actually worry about applying their expertise and their drive for innovation in mobile health, because it is a field where actually many of the important questions that are necessary to be asked in order to be successful as an entrepreneur are unanswered. There are policy issues that are yet not fully understood. There are questions around reimbursement. There are questions around how do I explain my value proposition to an investors with business models that are yet in the making and not yet proven. There is really not much data to make for a convincing argument just yet, even though I believe we will have it soon.
That is right.
Actually, I encourage entrepreneurs to jump on it right now, because this is the time when these questions can be answered by those that are making mobile health. So it's a great time to be in. Do not delay your passion just because you're facing uncertainty. I actually think uncertainty is one of the things that successful CEOs need to be able to handle best, and it is very true for mobile health.
Exactly. This is something that it is very unpredictable. It's a volatile field in that sense. But in the blink of an eye, if you don't really react to your passion, then you may actually lose your opportunity. And there's great opportunity in mobile health to pretty much any sort of entrepreneur, any sort of clinician, any patients involved in this field, because there's only a paucity of, even though there's many applications, there's a paucity of really strong applications that we can apply. The evidence that will happen, certainly many of the innovations that we have in medicine, before they could be implemented, they have to go through lots of scrutiny. But you don't really have to have multi-centric randomized prospective trials to say that something has value. And I think there's huge, tremendous value in mobile health.
And the drivers are incredible. You were mentioning just before this interview about how much you believe that these solutions can help you scale and reach out to many patients. And I completely echo that feeling. To be able to bring affordable and effective information and services in healthcare to a broad population, it's something that it's a great motivator and shouldn't deter anyone to starting right now.
It really is, and I hope you can see that I'm very passionate about that. As a surgeon, I really can be in the operating room all day. On the other hand, with the mobile technology, I could reach to many other places, at least with knowledge about their problems at some point in order to diagnose and hopefully one day to even treat. Having said that, this so-called MOOC, this massive open online course, is a clear example of some of this evolving online learning platforms. We don't really know if this is really meaningful, but we're betting on that, and we believe that is making a change in you guys.
It's something very important that probably our audience should know. There is certainly a class on BioDesign for mobile health. There is a MOOC that is trying to foster entrepreneurship. There are several activities that are happening at Stanford University in trying to foster a community of innovation in mobile health, and it can only grow. I'm very excited.
And Marta and I were very receptive of, entrepreneurs, very smart people, innovators like you, to actually get in touch with us with ideas, anything that you can think of value, and we'll be more than happy to work with anyone, I'm sure.
Absolutely.
Very good. Well, Marta, thank you so much again. Grazie mille for staying, for being with us today, and I look forward to hearing from the audience.
And I look forward to having many more students in the class this time.
Excellent. Very good.
Thank you.